A 44-year-old woman in Louisiana arrived at the emergency room after weeks of severe, unrelenting vomiting. The retching was so violent, she reportedly lost teeth. She had been using Ozempic and Mounjaro, medications designed for type 2 diabetes that have become the most sought-after weight loss treatments of the decade. That Louisiana woman, along with a patient named Jacqueline Bjorklund, were among the first to realize their bodies were failing, and they filed the initial lawsuits against the manufacturers. Doctors diagnosed them with gastroparesis, in simple terms, stomach paralysis. The muscles that normally push food through the digestive tract simply stop working. Without those contractions, the digestive process halts. Food stops moving into the intestines. It sits and rots inside the paralyzed stomach. Bjorklund and the woman from Louisiana were just the beginning. Today, more than 3,500 people are suing the drug makers. The central claim in these cases is that while these patients used the drugs to improve their health, they were never warned that total stomach paralysis was a potential consequence. Medications like Ozempic and Wegovy are GLP-1 agonists. Their intended biological function is to slow down gastric emptying. By keeping food in the stomach longer, the drug ensures the patient feels full, which suppresses their appetite. But there is a narrow biological threshold between a helpful slowdown and a complete system failure. When gastric motility drops to zero, the patient experiences a functional obstruction. A 2025 case study in the journal Curious documented how this occurs. Researchers found that rapidly escalating a patient's dosage without a gradual titration schedule can trigger a complete intestinal shutdown. Once the stomach paralyzes, the biological fallout is severe. Persistent vomiting and the inability to tolerate liquids lead to acute kidney injury secondary to dehydration. Because the manufacturers specifically engineered these drugs to slow the stomach, plaintiffs argue that total paralysis was a foreseeable biological risk that required a clear and severe warning. Now, a terrifying second wave of medical reports is emerging, patients waking up to sudden, irreversible vision loss. This chart shows the risk for a condition called NAION. Data presented to the American Academy of Ophthalmology suggests that patients using GLP-1 medications are up to 68 times more likely to develop this blinding condition than those using other treatments. These injuries form the basis of a failure to warn legal argument. For years, the manufacturer Novo Nordisk only warned of mild gastrointestinal side effects, like nausea, on early labels. It wasn't until January 2025 that the FDA added a warning stating, "The drug is not recommended for patients with severe gastroparesis," years after thousands of patients had already begun treatment. The legal system has responded by grouping these thousands of individual cases into a single federal battle. Multi-district litigation 3094 is currently proceeding under Judge Karen Marston in Pennsylvania. Consolidating these claims into an MDL allows the court to manage the massive scale of medical evidence and provides a path for these thousands of patients to seek a federal trial. For the patients involved in this litigation, the damage is permanent. There is currently no cure for gastroparesis. Even after stopping the medication, many of these individuals face a life of anti-nausea drugs, highly restricted diets, or reliance on permanent feeding tubes. The first bellwether trials are anticipated for late 2026. These test cases will determine the financial payouts and set the precedent for thousands of other victims. The drug makers maintain their defense, stating that they provided adequate safety information and continue to stand by their medications. The biological mechanism that makes these injections work is the same mechanism that can paralyze the stomach. It leaves patients to decide if the promise of weight loss is worth the risk of permanent organ failure.